Good day to Sir Izzuddin Faris. My name is Sharifa Zahara and my group members, Mariana Chong, Nur Aina Sabrina, Alia Natasha, and myself will be presenting a demonstration of the sports-related injuries on the bandaging skills. As an introduction, bandaging skills is the binding of a body part with a protective piece of fabric in applying pressure to a bleeding wound. When combined with a dressing, for example, the dressing is applied directly to the wound and bandage is placed to tighten it up. It is essential and important skills for those who are affected from medical condition. However, there's a fall in a perfect bandaging skills where the poorly constructed bandage will be ineffective and overpriced. In the worst case scenario, it can cause discomfort and suffering along with resulting in severe harm. There are several types of bandages accessible in these areas and otherwise examples of the practical application. That is all from the introduction. I will then proceed with the first chosen bandaging skills, which is wrist. My name is Sharifa Zahara and I will again be presenting on my part of the bandaging skills, which is the figure of 8 skills on wrist. To begin with, the wrist is known for their fragile bones that are linked together by a network of structured ligaments as the wrist assistance in keeping the bones in place with stable joint. Wrist injuries are frequently caused by sprains or fracture resulting in a sudden injury and repetitive motion involving wrist stress such as football, bowling, golf, gymnastics, and many more. Generally, wrist sprain arises as the strong ligaments that supports the results of wrist rupture. A sprain is an injury to the wrist ligaments that can range within a little sprain or tear in the ligaments to a complete rip through the ligaments or its connection to the bone. I will then explain on the bandaging skills, figure of 8 on the wrist sprain. The wrist figure of 8 bandaging skills is defined as the continuation of the hand and the major circular turns of the wrist, which is regarded as the great technique for the hands and wrist bandage. There are a few commonly used of the figure of 8 skills, such as the retained dressing to exert pressure for joints and for sprains on wrists and ankles. In the bandaging process, the bandage is usually wrapped around a straight portion above the injured area, with continuously pulled down below the wooden area, wrap halfway around, and return to the starting place to form an 8. In my demonstration, the list of supporting equipment that I used are roller bandage, adhesive dressing, surgical tapes, and medical gloves. Without further ado, I will continue with my steps for the figure of 8 bandaging skills on the wrist. I'll be wearing the medical gloves in the midst of my demonstration, which to prevent direct hand contact with the injured parts. Continuing with that, I'll prioritize on the dressing, cleaning with mild soap and water and place a clean dressing over the entire wound using adhesive bandage. I'll start by anchoring off the corner of the roller bandage below the fingers and covering the different layers of the bandage continuously. Roller bandage helps to immobilize and to hold dressing to support an injured portion in order to produce pressure to limit bleeding, especially in the hands and wrist area. While anchoring, I'll change the direction between below the index finger and below the thumb finger around 3 to 5 times as to avoid the bulkiness of the bandage at the end product. Once the bandage has crossed the 5th anchor, I'll use the spiral pattern which wraps the wrist downward till it reaches the end. It is more comfortable and secure to end the bandage around the wrist for tightness and mobility factors. Afterwards, secure the end of the bandage using a piece of correct size of surgical tape and tape between the bandage wrap and not directly on the skin. Lastly, to ensure a secure and proper bandaging skills, we can ask the patient to turn their hands or make a fist. Here are some close-up on the neat and proper application of the wrist bandaging skills. That is all from my portion of the video, and I will pass to the next presenter for their demonstration. Thank you.
Assalamualaikum and good day to Sir Faris Izzuddin. Before I start, my name is Noraina Sabrina and I'll be explaining on how to exactly to do a head bandage. Bandage serves three functions which are keeping wounds free of infection, controlling bleeding, and providing additional protection and support. Although sterile gauze is preferred in emergency, just about anything actually we perform. Scarves, t-shirts, socks, linen, stockings, and even belts are few examples. There are two types of head bandaging that we advise to use, which are triangular and cravat bandage for head injuries, and also roller bandage also can be used to treat the head injuries. Before we move on how to do the bandage, there are a few equipments that I would like to introduce before we start the bandaging, which are basically firstly you need to have a bandage. For the head injuries, there are two types of bandage that we need to use, which are triangular bandage and also roller bandage. So this is the roller bandage you can use, and also in case you don't have any triangular bandage at home, you can actually use any clothing that you have at your house. For example, you can use scarves, you can use any t-shirts and a lot of things that you can use to treat the injuries. Next, you're going to have a medical gloves. Medical gloves are basically the basic necessity that you need to use to injure patient. So basically, medical gloves to prevent bacteria from spreading to their wounds. That is why you need to use medical gloves. Lastly, in case if you do have, you can use a gauze sponge. This sponge can absorb slippers body fluids before treating a wound and also act as sterile barrier against dirt and bacteria. So now I will be explaining on how to perform the head bandaging. So firstly, dress the wound, put on gloves or use other protection to avoid contact with the victim's blood. So firstly, if there's any blood, you can use a cotton ball to wipe it off. And also if you do have a sterile gauze, you can put the injured part with the sterile gauze. So in head bandaging for head injuries, there are two types of bandage we can use, which is triangular bandage and also roller bandage. But now I will demonstrate to you on the triangular bandage. So using a moist triangular bandage, fold an edge of the base of the bandage. Put the bandage above the victim's head with the base of the bandage just above the eyebrow. After that, cross both ends of the triangular bandage on the back of the head with the tip of the bandage on the bottom of or tuck in the crossing. Then bandage to the forehead, tie a knot and tuck the loose end. Lastly, at the back of the casualty head, pull the tip of the triangular bandage gently, then fold and tuck it in. To summarize, it is important to do a proper bandaging techniques when using the first aid on the wound or injury. The purpose of triangular bandage actually is to apply pressure to control bleeding from wound or injuries and to hold dressing on the wound as well. The main goal of placing a bandage on an injury is to protect, to support, and to compress. If the bandaging technique is not done properly, it can make the injuries much more worse. So that is why it is important to know the basic on how to do the bandaging. So that is all from me. Thank you so much.
A token of gratitude to the previous presenter. Hello and good day, Sir Faris. My name is Marina Chong, and it is an honor for me to present about this ankle bandage. So this ankle bandage actually is actually one of the skills and the wrapping skills that I needed to use on the ankle, part of the ankle, one of the foot or ankle. All right, so this is actually caused by the sprained ankle, where that certain person actually twist and turn in an awkward way or unusual way, and then when they don't land properly, and then actually causes a snap between the foot and the ankle in very eerie way. Okay, so actually this could lead to swelling up towards the ankle, and it's very necessary for it to be wrap up the ankle, all right, so that the ligaments of the joint inside of the ankle could be recovered. So this is actually one of the things that the inside of the ligament of the ankle tear up or stretch out when that person actually sprain their ankle, that causes them a pain because the ligaments of the tissue is actually stretches out, so lead it to a painful uh, injuries, right? So one of the skills for it to be wrapped is compression wrap. So what can it be help is that this compression wrap to compress the of the ankle part so that it could recover and help to reduce the swelling part of the ankle, and of course help to the ligaments of the joints to be recovered slowly. Okay, so that's what of the compression help to do on the ankle wrap. So this compression wrap is actually wrapping up like in the number 8 kind of pattern. From the bottom slowing up, you wrap it up to the upper part of the ankle. Right, so this wrap should be cover about the entire foot, but only the end about 7 centimeters above the ankle. Okay, so one of the so one of the negative effect for these ankle injuries or ankle bandage is that if you don't use the ankle bandage properly or you don't wrap it properly, it could actually causes a long life pain of the ankle, right? It actually where the joints won't be recovered, and it could lead to unstable joint and weaker and easily re-injured ankle in the future. Okay, so the list of tools and equipment that we uses in this ankle bandage is AED bandage, which is also known as the elastic type of bandage, right? That actually quite popular and also actually common to be used in wrapping an injured type of injuries such as knee injuries or wrist injuries. And another thing is that the metal fasteners will actually come with the AED bandage. And if there is no metal fasteners to be in that bandage, you can use medical tape to stick it up at the end of the roll. So I will be showing you how to use this ankle bandage step by step.
So first off, this is the AED bandage. Recommended a white type of bandage because it is easier to use. Make sure the foot is gently washed and dried. And the coverage for the wrap is from below the toe and up to 7 centimeters from the ankle. The bandage would be easier to wrap it like this. Wrap it around twice. After that, start going up, then going down, then going up, then going down with the patterns of number 8. Make sure the wrap is not too tight. It could cut off the blood flow around that part of the wrap, nor too loose, it would not reduce the swell. And of course, make sure when you wrap, don't leave any wrinkle. Make sure it's a smooth surface. The upper part of the wrap could loosen a bit and a bit tighter at the lower part of the foot. It is better to end the roll at the upper part of the ankle.
Secure the end with the metal fasteners or the medical tape. But for me, I don't have those, so I will secure it by folding it nicely. That is all from me. I will pass it on to the final presenter.
Hi and a very good day to Sir Faris Izzuddin. My name is Aliana Tasha Zulkifli, and today I will be showing you how to do dressing and bandage on the forearm. So let me introduce with the supportive equipment first. So here I have the first aid kit. Inside the first aid kit I have the roller bandage. I have a pair of medical glove and adhesive arm bandage and medical tape, and I have the wound wash spray, goose pads, and lastly I have the antiseptic cream. Before we get started with the dressing and bandage, we have to use the medical glove first for safety and hygiene. Let's say the patient have wound over here, and then we have to take the wound wash spray and spray 1, 2 to 3 times, and then we take the goose pads and tap 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 tap. After that we take the antiseptic cream just a pea amount of antiseptic cream, then apply smoothly on the wound. After that we will need the adhesive bandage, and after that we will need the roller bandage, and roll it 2 times on the wound area. After that go downwards and roll 2 to 3 times. Make sure the bandage is not too tight and not too loose, and then go upwards on the wound area and keep on rolling until the roller bandage finish. Can you help me to hold the bandage? And after that we will need the medical tape to secure the bandage. Are you comfortable? Yes. Okay. Okay. Alright, there's no bluish color on the wound area, and I think it's okay. In conclusion, it is obligatory for everyone to have first aid kit at home and learn basic dressing and basic bandaging, because we could not expect when and where a bad incident will happen to ourselves and our family members or friends or stranger. So with this basic knowledge, we could help others and save their life. All right, thank you